Today we're exploring a chronic and progressive condition that leads to the destruction of red blood cells.
The diagnosis and management are critical for this devastating and potentially life-threatening disease.
Let's go behind the mystery.
My symptoms first appeared when I was 29 years old, and they were mostly stomach issues, gastrointestinal issues. I was vomiting. I had dark-colored urine, and I was really, really tired and fatigued. I went to a doctor, got an appointment, and he started running labs and different tests, having test after test, scans. I had procedures that I knew nothing about. So my doctor ordered a HIDA scan, which shows the functionality of your gallbladder, and it was not fully functioning. So when they saw that that organ was not functioning, we did have it removed. The symptoms were still there. They were slightly different. Instead of vomiting, now I was dry heaving. And I realized that was not the answer. And I ended up getting a liver biopsy. That came back abnormal. So then that led to an MRI, where the MRI finally gave us some answers, and it showed that I had blood clots in my liver. And about a month later, I had other blood tests come back where it finally connected the dots for us, and we finally had our answer. From the time I presented with symptoms to the time that I finally connected all the dots and got an answer was 11 months. And I was diagnosed with Paroxysmal Nocturnal Hemoglobinuria, also known as PNH.
PNH is paroxysmal nocturnal hemoglobinuria. It is a rare blood disorder which causes destruction of the red blood cells. So naturally speaking, within your immune system, there's the complement system. And in PNH, the problem is that constantly turned on, causing red blood cell destruction or hemolysis. And the problem is within the complement system, you have some proteins that are helping, which are absent in PNH. With PNH, hemolysis is constantly happening. Even when you're not noticing symptoms, there's destruction of red blood cells that is occurring in the body. Ongoing hemolysis is the root cause of symptoms in PNH, leading to fatigue, shortness of breath, dark-colored urine, trouble swallowing, abdominal pain, and erectile dysfunction in men. PNH can also cause potentially life-threatening issues such as anemia, strokes, heart attacks, blood clots, and multi-organ damage, such as liver and kidneys.
We had wanted to start our family, and obviously when you're that unwell, everything else takes a back seat, because now I'm not just this normal healthy girl anymore. Now I have something that is threatening my life, and so I really just jumped into learning as much as I could. I talked to my doctor. I was very prepared for appointments. I went in with questions front and back. I did as much research as I could and wanted to be educated and prepared. And then the things I didn't know, I asked. So the damage that PNH did to my liver was just too severe, and my liver just never repaired itself. So I did end up getting a liver transplant. Upon diagnosis and before receiving my first treatment, I had to receive the meningococcal vaccine. And after that, I recovered. My PNH was managed through treatment, and I was able to move forward in life and start my family.
PNH is caused by a mutation in the body's stem cells, which are in the bone marrow, where the red blood cells are made. PNH is an acquired disease, which means it is not inherited and you cannot pass it down to your children. Instead, you develop it over time. PNH may be difficult to identify because the symptoms can mimic other diseases. If a physician is concerned, a test can be ordered, which is a blood test called flow cytometry for diagnosis of PNH.
When I started PNH treatment, I was receiving an infusion every other week, every 14 days. And, it's what you gotta do, and so I did it. But I wasn't able to live my life the way I can today. My life revolved around the treatment dosing schedule. Besides treatment, I was also still working a full-time job, and I was very active in my church as a worship leader. So with work and church and then treatment, there wasn't room for much else.
As a chronic and progressive condition, it's important to take an active role in your health and work with a physician to manage the different signs and symptoms that may develop. While we may not see what's happening below the surface, and even when a patient feels fine, lab results can reveal potential problems. So speak with your physician so correct lab tests and imaging can be ordered. Keeping a record of results can help patients and their doctors be aware of any changes that can occur over time, including the risk of blood clots, which is the leading cause of death in PNH. Because serious health problems of PNH are caused by ongoing hemolysis, reducing it is the key to managing PNH. So it's important to speak with a doctor about management options.
Behind the mystery of PNH, we'll be right back. Welcome back to Behind the Mystery. Let's hear from Dr. Ahmad about a treatment option for patients with PNH.
For patients with PNH, having treatment options that suit them and their needs is critical to providing better outcomes. One option that I offer my patients with PNH is Ultomiris. Ultomiris, a ravulizumab-cwvz, is a prescription medication used to treat adults and children 1 month of age and older with paroxysmal nocturnal hemoglobinuria, PNH. It is not known if Ultomiris is safe and effective in children younger than 1 month of age.
Ultomiris is a medicine that affects your immune system and may lower the ability of your immune system to fight infections. Ultomiris increases your chance of getting serious meningococcal infections that may quickly become life-threatening or cause death if not recognized and treated early. You must complete or update meningococcal vaccines at least 2 weeks before your first dose of Ultomiris. If you have not completed your meningococcal vaccines and Ultomiris must be started right away, you should receive the required vaccines as soon as possible. If you have not been vaccinated and Ultomiris must be started right away, you should also receive antibiotics for as long as your healthcare provider tells you. If you had a meningococcal vaccine in the past, you might need additional vaccines before starting Ultomiris. Your healthcare provider will decide if you need additional meningococcal vaccines. Meningococcal vaccines do not prevent all meningococcal infections. Call your healthcare provider or get emergency medical care right away if you get any of these signs and symptoms of a meningococcal infection. Fever, fever with high heart rate, headache and fever, confusion, muscle aches with flu-like symptoms, fever and a rash, headache with nausea or vomiting, headache with a stiff neck or stiff back, or eyes sensitive to light.
Please see additional important safety information throughout this video and visit ultomiris.com/PNH for the full prescribing information and medication guide for Ultomiris, including boxed warning regarding serious meningococcal infections.
At one of my follow-up visits, my hematologist discussed a different treatment option that would allow for more freedom in my dosing schedule. In our discussions, we talked about starting infusions of Ultomiris. She explained to me that it's a complement inhibitor indicated for adults and children 1 month of age and older with paroxysmal nocturnal hemoglobinuria, also known as PNH. The doctor and I discussed the benefits and risk of treatment, including that I would need meningococcal vaccinations at least 2 weeks before my first dose of Ultomiris, due to the risk of serious meningococcal infections. We further talked about the most common side effects, which are upper respiratory infections and headache. We decided Ultomiris would be a good fit for me. I'm very much into doing my research, and I asked if it had the data to support the efficacy, and she told me that it was studied in the largest PNH clinical trial program to date, which made me feel confident I was making the right decision for me.
Ultomiris is a treatment that is designed to target the cause of PNH damage, intravascular hemolysis, or IVH. Ultomiris works by targeting complement, a key cause of hemolysis in PNH. It works to reduce the risk of intravascular hemolysis, blood clots, and fatigue. Patients can have more disease control and fewer symptoms such as abdominal pain, shortness of breath, difficulty swallowing, and chest pain. Ultomiris was studied in the largest ever PNH clinical trial program. Ultomiris is the only long-acting PNH medication that can provide continuous symptom relief as few as 6 treatments per year after a loading dose. Long-acting Ultomiris with infusions only once every 8 weeks allows patients more flexibility in between treatments. Living with a rare disease like paroxysmal nocturnal hemoglobinuria or PNH can be a challenge. However, the more patients know about it, the more equipped they can be to manage it.
After starting Ultomiris, I not only had less fatigue between infusions, but I had more flexibility in my life because of the freedom of the infusion schedule. Treatment used to be every 2 weeks, and now they are every 2 months after a loading dose. I can plan infusions around my life, not plan my life around my infusion schedule. I look at my life today and I'm more than just PNH. I learned that you have to have hope, and I have that and so much more.
We want to thank Brittany for sharing her story and Dr. Ahmad for her expertise.
For further insight, speak to your doctor and visit ultomiris.com/PNH.
Stay tuned for the full important safety information, including boxed warning.
Your healthcare provider will give you a patient safety card about the risk of serious meningococcal infection. Carry it with you at all times during treatment and for 8 months after your last Ultomiris dose. Your risk of meningococcal infection may continue for several months after your last dose of Ultomiris. It is important to show this card to any healthcare provider who treats you. This will help them diagnose and treat you quickly. Ultomiris is only available through a program called the Ultomiris and Soliris Risk Evaluation and Mitigation Strategy, REMS. Before you can receive Ultomiris, your healthcare provider must enroll in the REMS program, counsel you about the risk of serious meningococcal infections, give you information about the signs and symptoms of serious meningococcal infection, make sure that you are vaccinated against serious infections caused by meningococcal bacteria, and that you receive antibiotics if you need to start Ultomiris right away and are not up to date on your vaccines. Give you a patient safety card about your risk of meningococcal infection. Ultomiris may also increase the risk of other types of serious infections, including Streptococcus pneumoniae, Haemophilus influenzae, and Neisseria gonorrhoeae. Your child should receive vaccines against Streptococcus pneumoniae and Haemophilus influenzae type B, Hib, if treated with Ultomiris. Certain people may be at risk of serious infections with gonorrhea. Who should not receive Ultomiris? Do not receive Ultomiris if you have a serious meningococcal infection when you are starting Ultomiris. Before you receive Ultomiris, tell your healthcare provider about all of your medical conditions, including if you have an infection or fever, are pregnant or plan to become pregnant. It is not known if Ultomiris will harm your unborn baby. Pregnancy Registry. There is a registry for pregnant women who take Ultomiris to check the health of the pregnant mother and her baby. If you are pregnant or become pregnant while taking Ultomiris, talk to your healthcare provider about how you can join this registry, or you may contact the registry at 1-833-793-0563 or www.ultomirispregnancystudy.com to enroll. Are breastfeeding or plan to breastfeed? It is not known if Ultomiris passes into your breast milk. You should not breastfeed during treatment and for 8 months after your final dose of Ultomiris. Tell your healthcare provider about all the vaccines you receive and medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements, which could affect your treatment. If you have PNH and you stop receiving Ultomiris, your healthcare provider will need to monitor you closely for at least 16 weeks after you stop Ultomiris. Stopping Ultomiris may cause breakdown of your red blood cells due to PNH. Symptoms or problems that can happen due to red blood cell breakdown include drop in your red blood cell count, tiredness, blood in your urine, stomach area, abdomen, pain, shortness of breath, blood clots, trouble swallowing, and erectile dysfunction, ED, in males. What are the possible side effects of Ultomiris? Ultomiris can cause serious side effects, including infusion-related reactions. Symptoms of an infusion-related reaction with Ultomiris may include lower back pain, stomach, abdominal pain, muscle spasms, changes in blood pressure, tiredness, feeling faint, shaking chills, rigors, discomfort in your arms or legs, or bad taste. Stop treatment of Ultomiris and tell your healthcare provider right away if you develop these symptoms or any other symptoms during your Ultomiris infusion that may mean you are having a serious infusion-related reaction, including chest pain, trouble breathing or shortness of breath, swelling of your face, tongue, or throat, and feel faint or pass out. The most common side effects of Ultomiris in people treated for PNH are upper respiratory tract infection and headache. Tell your healthcare provider about any side effect that bothers you or that does not go away. These are not all the possible side effects of Ultomiris. For more information, ask your healthcare provider or pharmacist. Call your healthcare provider right away if you miss an Ultomiris infusion or for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see the full prescribing information and medication guide for Ultomiris, including boxed warning regarding serious meningococcal infections at ultomiris.com.